I think the day that I had the stroke, I would credit that to the taxpayer that I was getting ready to seize his property that day. I don't know what he prayed, but whatever he prayed, it worked. Because as soon as I touched that file, I hit the floor, and I never went back to my career as a revenue officer with the IRS.
Now, before we get started, as I've said before, I think you are hilarious. And for those of you who may not be familiar, your signature tagline as you burst into your son Addison's room is, pick that stuff up off the floor. Now,
That's right.
Any parent of a teen or a young adult can relate to that. And as I was reading your bio, I found out you were a tax accountant with the IRS,
Yes.
which is about as far away from funny as I can imagine. So let's talk about how you went from being a tax accountant to a social media personality, businesswoman spokesperson, and inspirational speaker on cardiovascular disease. So tell me, how did you make that transition?
Right. People don't think accountants are funny. I think we are the funniest people out there. So I like to some people call it coincidental. I call it Godcidental. I have been someone who's always been funny, always been entertaining, love laughter. So that was something that was always in me, has been deposited in me as a gift. I ended up being a revenue officer, which I loved, right? I loved. So everybody wants the good government job. I planned on retiring and ended up having a stroke on the job. I think the day that I had the stroke, I would credit that to the taxpayer that I was getting ready to seize his property that day. I don't know what he prayed, but whatever he prayed, it worked. Because as soon as I touched that file, I hit the floor, and I never went back to my career as a revenue officer with the IRS. And so,
wow, well, that's some kind of exit from your job, my dear.
Yeah.
That is some kind of exit. But I want to talk about that a little bit more. But before we get started into your story, which is fascinating, I want to give our audience a little bit of the basics before we dive deeper. Now, cardiovascular disease is so prominent in this country. And what people don't know is that more people die of heart disease than all cancers combined.
Correct.
And cardiovascular disease is not just heart attacks. It includes all diseases of the heart and blood vessels throughout the body. And many people, including medical professionals, don't realize that the symptoms of heart attack in women can look very different than those in men. So we're going to get back to your story. And ShantaQuilette, now you had a heart attack and multiple strokes. Was it before age 40 or right at 40?
It was right before, so it was 39 and 40.
Wow. I want to go back. Before we talk about that, can you tell me what was your life and lifestyle like, say, a year or two before the heart attacks? What was the state of your health coming into this? So
that was 2018. So I'd like to go further back because I'd like to go back to 2012 when I started having my symptoms. During that time, I was very active. I was working out. When I started feeling the palpitations in my heart, I happened to be running on a treadmill. So during that time, I was pretty physically fit. I was exercising. I was eating fairly good, and I didn't have any previous issues prior to that. Now, 2 years before my heart attack, I had ended up I gained about 60 pounds. I was working at the IRS and also running a nonprofit, the Pink Peppermint Project. So my life was pretty fast paced. So at the time, I'm being told pretty much nothing is wrong. I was diagnosed with exercise-induced arrhythmia, which would explain why I gained the weight, because doctors told me while I was exercising and my heart was elevating, that was causing the palpitations and causing my blood pressure to go up.
So let me ask you this. We know about the palpitations, and you were having that when you were exercise, but then clearly you were having other symptoms.
Yes.
That would make you go back and forth to
shortness of
doctor.
breath.
And what Yeah. Shortness of breath.
Yes.
What else?
Shortness of breath, chest pains. A lot of times I would feel really tired. I feel really tired and really exhausted without doing anything. Like, I kind of wake up tired. I'd wake up tired and feeling exhausted. And because I had been gaslit so much, I started gaslighting myself. So when I woke up tired, it was just because I did too much. I was doing too much. I was moving slow. I'm picking up weight. I'm overweight. So yeah, I would have headaches every now and then. But every time I'd have the sharp chest pains, I'd go into the emergency room. I'd get an EKG and I'd be told an X-ray and blood work, and I'd be told I was okay.
But you knew you weren't okay. You knew that.
I knew. I felt that.
Did you have any problems with any of your pregnancies?
I did. I had pregnancy. I mean, I had issues with all three of my pregnancies. I had issues with my son's pregnancy. So much I had so many issues that they told me that I didn't need to get pregnant anymore.
What were the issues?
So one of the issues is with my son, my placenta started failing. And so he wasn't getting the nutrients that he needed. And so for about 6 months, I went without knowing that I was pregnant because I was told that I had a miscarriage. I had told I had miscarried. And during that time of me going back and forth to the hospital, when they would test me, my HCG was basically clocking as if I wasn't pregnant. And so it wasn't until my doctor decided, I think maybe the third time, well, not her particularly, but after me going back and forth to the hospital, complaining about nausea and vomiting and different things, they decided to test do an ultrasound. She called me into the office to do an ultrasound. And when they did the ultrasound, they determined that I was pregnant, and I delivered him like 2.5 months later because they thought he would thrive better on the outside than he was doing on the inside. They called it something like the hook. It was called something. They called it the hook or something.
It's, you know what, it's called, there's a condition, it's called IUGR, which is intrauterine growth retardation. And that is sometimes a sign of having some vascular disease. That's why I asked whether or not you were having problems during pregnancy, because that sometimes is a warning sign for who is at risk for developing cardiovascular disease later. And I want all of our listeners to understand that sometimes pregnancy is the first indication that heart disease is that you're at risk for heart disease. And that is because people don't realize, but pregnancy is your first real big heart stress test. Because during pregnancy, your heart is having to work 1.5 times normal. You have 1.5 times more blood volume to push around during pregnancy than you do when you're not pregnant. Because you're not only circulating for you, you're doing the circulation for your baby and your placenta. So sometimes that is a warning sign. So if anyone is listening, if you've had pregnancy-induced hypertension or preeclampsia, either before delivery or after delivery, just know that you need to be monitored more closely, because that is, again, an independent risk factor. All right. So
where were you when I needed you?
I know. You would be surprised, or maybe not. I, in addition to the patients that I take care of and I took care of over the years, I also was the informal advisor for my friends, my family, my friends of friends, because situations like this would come up. They would go in and they'd come back and they said, what did they do? What did they do? And you have to really, I would advocate for them. And I'm not their doctor. I'm not taking care of them. But it requires someone to go and ask the next question and really not be intimidated. And this is another reason why I often will tell patients, if you are not getting the answers that you think, that they don't feel right in your spirit, you're like, wait a minute, that doesn't sound, I don't know what the answer is, but this does not feel right. Sometimes you either have to take someone with you to advocate for you, or you vote with your feet and you have to say, well, that didn't sound right. So let me go and get a second opinion because this doesn't seem to make any sense to me. So, all right, so you get through this pregnancy. The only signal you have other than clearly something, I don't know what was going on about why they couldn't figure out whether you were pregnant for 6 months, but that's a red flag. So these doctors, all right, now you're OBGYN and you have an internal medicine doctor or a primary care doctor that you're seeing. Did you also see a cardiologist?
So I wasn't seeing a primary care doctor, but I was going back and forth to my OBGYN. So there was a nurse practitioner that was doing my well woman. And anytime if I got sick, I would go, like I got a cold, then I'd go to Dr. Linda and she would, do a prescription.
Okay.
But when I came to her after I was having the palpitations on the treadmill, which I did immediately, she's the one who referred me over to a cardiologist. So I was seeing a cardiologist.
So, okay. Well, you were seeing a cardiologist and the cardiologist did not recognize what was going on. Okay. Yeah. And I think that they were probably, people are thrown off by what they see in front of them. Yeah. I think if anybody else coming in with these same symptoms, if you were a man, or if you were, and certainly if you were a white man, I think a different set of tests might have been ordered and may have been evaluated. But, because we as doctors, we get caught up into we have an image of who we think gets what. So whatever the picture in your mind is of who's a heart attack person or who's a stroke person, you're thinking of someone elderly. And you're certainly not thinking of, a 30-some-year-old woman who's coming in to talk to you. But sometimes you have to believe what people are saying and not just what you think. You have to disprove whatever it is that the idea that you have in your head. So the one thing I didn't ask you about, and I do want to know, do you have a family history? Has anyone had a heart attack or a stroke in your family? Good question.
So this is where a lot of accountability comes in, because the one thing that stands out, and if I could go all the way back, is when my doctors were asking me about my family history. My cardiologist asking me about my family history and asked me about my dad and my mom and my grandmother and whether or not they had heart issues. I was not aware that my parents had heart issues. I was not aware of that. I did not become aware of that until my heart attack. And my mom had had a mild heart attack. My mom had had a mini stroke, which we were not aware of, that she did not allow us to be privy to. And then after I had my stroke, that's when I found out that my dad has the same condition that I have, has been on the same medication that I'm on for years. And he just did not think that it was important for us to know that information. So I do feel like had I gone and talked to my doctor about, well, hey, my dad has ASCVD, or my mom has had a heart attack, a mild heart attack, or my dad has had issues with cardiac arrhythmia, then the doctor would have maybe said, okay, let's dig a little deeper, versus, okay, we're going to do a stress test. You have cardiac exercise arrhythmia. Don't exercise. Make sure you eat right and go on along your way.
Okay, so ShantaQuilette, now you were complaining years before you were ultimately diagnosed with your heart attack. How many doctor's visits, ER visits would you estimate that you had between when you were first started having symptoms and when you were ultimately diagnosed?
Probably at least 30 to 40.
Oh, wow. 30 to
I'm
40.
thinking 3 to going to the doctor, between the doctor and the emergency room each year, between that 7 to 8 years, probably 3 to 4 times a year. I was going to the emergency room, back to the doctor.
And now you're going that many times. So what is the doctor thinking? That you just like coming in to say hello? I mean, at some point, did a a red flag or something go off in here, and it's like, wait, maybe there's something else going on here.
I can't tell you what they actually thought, I was just doing what I thought that I was supposed to do, advocating for myself and not sitting home waiting for something to happen. I didn't feel well, so I went to the doctor. And when I went to the emergency room, I always had a follow-up. So I can say, if anything, I was consistent. I was consistent, but I just wasn't consistent with the right people.
Right. And I think that's fair to say that we, given your history, we cannot say that, oh, you were neglectful of your health. You were trying to do what you were supposed to do.
Yeah.
And people just weren't hearing you.
Yeah.
Every year, as New Year's approaches, my family and I have a little ritual. We pick a place where we can step into the new year with intention. Somewhere peaceful, somewhere that lets us close the chapter on the past 12 months and welcome the next with open arms. This year, we chose a quiet lakeside town. We wanted space to gather, cook, laugh, and stay up far too late, talking about the year behind us and the one we hope to build. As we settled into the home we booked on Airbnb, lighting candles, chopping vegetables, and putting on the playlist my kids tease me for, I looked around at the people I love most. There's something grounding about being together in a place that feels warm and lived in, especially as the calendar turns. And I found myself thinking, while we're here making our own New Year's memories, someone else could be enjoying our home and starting their year with a fresh sense of possibility too. Your home doesn't have to sit empty while you're away. It can become a gathering place for another family, a place to cook their first meal of the new year, to share their resolutions, to rest, reset, and step into the next chapter with hope. And the extra income you earn from hosting, it can help support the things you want to bring into your own life in the new year. Another trip, a long-awaited project, or simply a little more breathing room in your budget. Your home can help someone else start their year on a beautiful note and help you reach your own goals too. Your home might be worth more than you think. Find out how much at airbnb.com/host. Let's go to the heart attack. Okay. Yeah. How was the heart attack diagnosed?
Oh, so 2 weeks before my heart attack, I started having flu-like symptoms. Flu-like symptoms that came on very sudden, but also gradually, if that makes sense. It started out where the number one symptom was I felt really tired. I told you I was feeling tired before, but this was just an overwhelming feeling of tired where I just felt like I couldn't do anything. And I remember telling my husband, I just feel so tired. I was telling my boss, I felt so tired. I couldn't understand. Then I started having shoulder pain and headache. And I immediately diagnosed myself and was thinking I was coming down with the flu. I had been gaslit so many times. I just started gaslighting myself. I have the flu. I got to go to work. I don't have time for it to be anything else. And I continued to have those symptoms, like I said, for about 2 weeks. The evening that before I went into the ER, I was at work and I decided to leave work early because I thought my flu symptoms were getting worse. So I told my coworker, I said, hey, I'm going to go home. I'm going to go home and finish out the day at home. I went home. My daughter was there. My husband was there. My husband was preparing to go to work. And he works in air traffic control. And so he said, hey, I know you've been talking about
not two not stressful careers there: a tax accountant and air traffic controller.
He's not a controller, but he works in that. He works in that environment.
Still, you're in that environment.
You're in that environment.
Oh
yes, and so I totally agree. And so he was saying, I had been, talking about not feeling well, and he said, hey, do you need me to take you to the hospital? I said no. And he made it clear. He's like, hey, I cannot, once I'm at work, I can't leave. I don't have that kind of job, so I'm not going to be able to leave. I assured him that I was okay If I felt bad, I'd go to the doctor. And so he went to work. I was in my office doing some tax paperwork, and I had taken a call, and he called me on the way and said, "Hey, how are you feeling? Are you still feeling bad?" And I said, "I still feel the same, but don't worry about me." In that same conversation, he called my daughter. He texted my daughter and said, "Hey, I need you to get up." And she was at home for the summer from school, from college. He said, "I need you to get up and I need you to take your mama to the hospital right now." And she thought that I had the conversation. I didn't know he had the conversation with her, but she came down and she opened the door and she said, "Mama," she said, "are you ready?" And I turned around in my little spinning chair and I said, "Ready for what?" And the minute I said, "Ready for what?" I felt a sharp pain go down my jaw, down my neck, down my left arm. And I knew I didn't know what it was, but I knew it was something that I hadn't felt before. And so we got up. The hospital was about 5 to 7 minutes away. Mm-hmm. So they did do the EKG. And I remember the nurse saying, "Well, it looks like, it may be because you're a little excited. But everything looks good." They put my wristband on and they sat me back in the waiting room. I sat back in the waiting room, and this is when the pulsating pain comes a little bit more. It's a little deeper. It's more like pressure now. And it feels like I can't breathe. And I remember saying, "I feel like somebody is stepping on my chest." And by this time, I don't know how loud I had said it, but the triage nurse was in my face and she said, "What are you saying, hun?" And I said, "It feels like somebody is stepping on my chest. I feel really pressure. I feel a lot of pressure on my chest." They didn't hesitate. They immediately got me back to the emergency room, got me back to the room. They gave me a nitroglycerin. They started, taking blood. Mm-hmm. And the ER physician comes in, starts asking me questions, starts listening to me. My blood pressure is high. I remember for a second, my heart rate starts going up really high. And my daughter starts screaming. And the nurse comes back in and she's like, "What's wrong?" And it was like, as soon as she came in, it was like my heart rate went back down. And my daughter said that her heart rate went up. And she said, "Well, we gave her some medication, so the medication could definitely do that." So I wait there maybe about 15, 20 minutes, maybe longer than that. The first ER physician that came in, he was jovial. He was smiling. He was talking to me. He was not in that same mood when he came back the second time. Mm-hmm. And he's looking around. He sits on his little stool, comes up, and he starts listening to me. Mm-hmm. Mm-hmm. And then I notice another doctor comes in, a tall doctor, and it says, I read vascular. I read that it said vascular on his chest. And I remember Dr. Tran leaning over to me and saying, "Can I ask you a question?" And I said, "Yes." He said, "What took you so long to come here today?"
Right. Now it's your fault, right? Now it's your fault. You took too long.
Yeah. And I said, "What do you mean?" He said, "Well, you said you've been having these symptoms for 2 weeks." And I was like, "Yeah, well, I thought, you were going to send me, y'all always send me home. So I thought I was having the flu." And he said, "Well, it's not the flu. And I want you to brace yourself when I tell you this. You're having a heart attack. You're having a myocardial infarction," is what he said. And, in that moment, I still, I did not know what that meant.
Right.
I immediately heard death. When you hear heart attack, that's right. All. I didn't at the time know anybody who had survived a heart attack. And so I have my daughter to the right of me, and there. And I remember just me being a comedian and being funny. I wasn't a comedian at the time, but I was a comedian in my own mind. I laughed and I said, "Well, do I get to stay this time?" And he said, "Yeah, you're definitely going to stay."
So what you were complaining about and what the symptoms you were having, like that, the flu-like symptoms, that's a very common complaint for women. Sometimes it'll look like heartburn or nausea or, just feeling fatigued. Those are classic symptoms for women. And I think what kept throwing people off is your age. because they kept saying, oh, no, that's, couldn't be that, right? For anybody who's listening, I if there's nothing you take away from this, I just want you to know that, again, do not minimize fatigue. It's not normal to feel tired after you've, had a good night's sleep. It's not normal for a 30-some-year-old to be fatigued walking around the house. That is a sign. And unless and until someone can tell you otherwise, you need an evaluation, the same evaluation than if you were 75 coming in with the same complaints. So, wow. So, all right, now let's go through the hospitalization. So now you're admitted. And then what did they do?
I would like to tell you things got better. I was admitted to the cardiac floor. The cardiologist and facility that I was going to is part of the hospital, right? So they're directly connected to the hospital. The acting physician on the cardiac floor happened to be my doctor.
Oh, okay.
So I'm admitted. All my family's in the room. All my family's in the room. At this time, I think I may have just had an X-ray at the time. But it's earlier in the morning. He comes in front of my family, my husband, my mom, and he says, I'm just going to tell you this. She's okay. She's going to be okay. I told her she need to lose weight. I told her she need to quit that job. I told her all the things that she needed to do to keep that from happening. So now, not only are you gaslighting me, you're gaslighting me in front of my family. And my family who already thinks that I'm doing too much, right? So now I'm there. I'm embarrassed. I'm sad. And now I'm, just, waiting for different tests. So at that time, I believe I got an echocardiogram. I got another stress test. I got some x-rays. I believe I got a CAT scan. And at that time, I was in the hospital for about 5 days. I was told that I did not have any heart damage and that it was in relations to stress.
Okay, stop there for a minute. Okay. As part of this evaluation, did you get an angiogram where
I did not get that.
They didn't inject the dye to look to see if you had any. No,
that wasn't until next year.
Okay. Because 2 points here. All right. I'm not a cardiologist and I don't even play one on TV. But let me just say that if someone who has had a heart attack and you have diagnosed a heart attack, seems to me that the next step would be, well, then let's see if you have any more vascular disease in your heart before we just rule that out. So no angiogram, right?
Nope.
And
didn't know what that word was.
So the next thing that stands out to me is that the stance where he came in and immediately starts blaming you. Oh, see, I told you, not, oh my, I'm so sorry.
Never.
Because that would imply that maybe I missed something along the way. So let me just hurry up and let's take the attention off me and I'm going to put it on you, which
it's basically like I was confirming what he had already said.
Okay. All right. Look at my face. Okay. All right. So you stay in the hospital 5 days. They said, okay, no heart damage. We don't know what the status is of your heart vessels are because nobody looked, right?
Right.
So what medications, what are you on when you leave the hospital?
I'm on the mighty clouds of joy. With the Lord, I left with the Lord on my side. I was my discharge paperwork. I was given some pain. I was given some pain medication. I wasn't given any blood pressure medicine. I was given a special diet, basically like a cardiac diet, and a follow-up visit.
And what was your function like after you got home? So in the months leading up to the stroke? Were you back 100%, 50%?
Oh,
How
no.
were you
Oh,
in
no.
terms of your function?
So I went about 9 months. And it felt like, to be honest, it felt like once and it might just been in my head, but once I changed positions, it seemed like I didn't have the frequency of issues that I was having, but they didn't go away 100%.
Okay.
Now I had a little added component that came on. I started having really bad headaches. And so that same year in November, I just was in the bed and it felt like somebody had just hit me in the head with a hammer. It woke me up out of my sleep. My head was hurting. I mean, it was pounding. My husband took me to the emergency room. They gave me a CAT scan and said that I was having a cluster headache. They told me it was a cluster headache. And they gave me some medication. And that was in November of the same year. I went on till about February into my next emergency visit, which was more chest pain. It was more chest pain. And they did, x-rays and that. But this is the time I had a doctor who I felt was the first doctor that actually was trying to advocate. So that doctor sat down and he had a little book, like a dictionary, and he was looking through his little dictionary of different things. And he said, "This is what I'm going to tell you. Do not go back to that cardiologist."
All right. So the stroke. Okay.
It's coming.
So now you've had all this stuff. Okay. So when does the stroke show up?
So here we go. So April 8th, ER physician at the time told my husband that I need to just get to a neurologist because of what they seen on the MRI. They sent me home. I could barely walk. So my husband says they wheelchair me to the car. He picked me up, and basically that's how he got me to the car. Got me in the house, holding me up, put me in the bed. Right. So I told you I was having headaches a while back. So because of those headaches, I went to see a neurologist, Dr. Angela Huff. I went to see the neurologist, and she's a Black neurologist. And my husband calls. My husband gets her information and calls. She's one of those doctors where she picks up her phone and answers, right? She's it's only her in the office and one other person. So my husband says he calls her. He calls her and he says, "Hey, my wife, she's a patient of yours, and I just came from the hospital last night. They said she has MS. Well, that morning, the reason what made him call immediately is because when I woke up, he just said I looked like my face was kind of distorted. He said I wasn't, like, I just was confused. I was just not talking. I wasn't communicating correctly. And so she told him to bring me to her office right away. Immediately, she knew I had a stroke. She knew I had a stroke. So immediately I'm sent to rehabilitation. I'm sent into rehabilitative care at Charlton Methodist, where she was acting a physician and neurologist. And I went through, during that time of diagnosis, I saw everything from, like I told her, a ventriloquist, a podiatrist, everybody you could think of, to make the final determination that I had ASCVD. Because of that stroke, I was in rehabilitation.
Tell people they don't know what ASCV.
I always try to say ASCV because I'm not so good at pronouncing the atherosclerotic.
I'll tell you. Yeah, atherosclerotic cardiovascular disease. It
atherosclerotic.
Means, yes. What I want people to understand too, and so you understand that there are two types of strokes. One is called an ischemic stroke, and that it just means that it's like a clot, or you've had the same thing where you've got the atherosclerosis, or you've got narrowing of the vessels, and really the same things that cause heart attacks cause strokes. You have a narrowing of the vessels, the blood supply gets cut off, and obviously your heart and your brain are the two parts of your body that need oxygen constantly. You can't go very long without getting adequate blood supply. So, but when you do a CAT scan or an MRI in someone that's had a clot or the not getting enough blood supply, it looks normal initially because you have to wait and see the changes after the tissue has actually, it's died. You got to see it later. So you may not see the findings right then, but you may see them 3 days later, a week later.
Yep.
The hemorrhagic strokes are the ones you can see because you bleed into your brain. So if you did an MRI right away on someone who had that, then you'd see all this blood in your head that didn't supposed to be. But again, not seeing a finding initially does not mean you didn't have a stroke. That's the point that I want to make. And your recovery has been nothing short of remarkable. And I think that would not have been as, perfect as it is, but you were young, and that makes a difference, in terms of your ability to recover from some of these things. Yeah. But I want to get now. So again, there are going to be so many teachable moments after this that I'm going to have to expand the list of things I want to talk about. But I really want you to tell me that if you knew then what you know now, okay, tell me how you would have, what points at which you would have changed how you interacted with these medical professionals along the way.
So the first or second time the doctor had told me that nothing was wrong, and still in my spirit, I knew something was wrong, I would have immediately challenged his assumptions. Or I would immediately went back to my doctor and asked for a referral to another cardiologist and to another doctor. And primarily a doctor that looked like me.
ShantaQuilette, it was so great to speak to you. We could have talked for another 2 days, but I think that I hope our audience gets the message. The one thing I want people to know is this, is that, as I said before, the symptoms of heart attack in women are different from men, and they're easily dismissed. And so if you're out there, if you're feeling chronic fatigue, if you know that you don't feel normal, let me say this again, no one knows how you feel better than you do. So if someone is telling you, oh, it's fine, it's nothing, if you know it's not, then act on that. Go get a second opinion. Do not sit there and let someone else tell you how you feel. That's important. I think the other thing that the most important thing is to also know what your personal risk factors are and know that things like obesity, diabetes, hypertension, and sedentary and, sort of inactive lifestyles not only increase your risk of heart disease, but they will also influence how you recover even after you've had an event. Yeah. And know what I told you before, that if you have had a problem during pregnancy, if you have had hypertension in pregnancy or preeclampsia, or you have had what you had with Addison, IUGR, which is intrauterine growth retardation, then that is a sign of vascular disease. Your placenta has a lot of vessels in it, and somehow they're not working properly. That's a sign. Make sure that you follow up on that. And your story also illustrates a very important point that I emphasize again and again, and that is know your family history. Because again, that will increase your awareness. And knowing that your family history is what it is does not destine you to that same fate, but it certainly gives you the opportunity to know what to look out for. And so you can start instituting these things, these preventative measures early on before you have a problem. And this is something that everybody should know. And I put this in my book, and this is about strokes. And it is like everyone should know the acronym FAST, F-A-S-T. Facial drooping is the F, arm weakness is the A, speech is the S, and T is time. Everybody in your family should know that. And if you have anybody who has any of those other risk factors, please know that. And what I tell you, everybody, and I think that, yes, we all need to be proactive about our health, and there's nothing that, that I'm going to tell you to do. And there's no medication that is going to replace just being proactive. So all those things that are boring, that nobody wants to hear about, and you've heard a million times, exercise and healthy diet and reduce stress, don't smoke, monitor your blood pressure. And if you have high blood pressure or blood or blood sugar, like diabetes, please take your medications, because there's nothing good that's going to come of it if you don't. And because, I spend a lot of time in menopause world. The other thing I want women to know is that if you are perimenopausal or menopausal and you are having hot flashes or what we call vasomotor symptoms, those should be treated. Hot flashes are also an indicator or that you may be at risk for cardiovascular disease. So if you have hot flashes, treat them. There is considerable evidence that women who start HRT early can have even a 30 to 50% decrease in cardiovascular disease. But again, it's a matter of starting it before, not afterwards. So if you have hot flashes, treat them, because hot flashes are not benign. Keep joining us each week on YouTube or wherever you get your podcasts as I break down complex medical issues and give you actionable advice on how and when to secure that second opinion. If you enjoyed the show, make sure to follow us so that you never miss an episode. And if you have a moment, leave a review. Until next time, take care.